My name is Eva Kim, and I am an ophthalmologist in Denver, Colorado. I'm with Icon Eye Care, and we have a practice that is anterior segment, and we're very surgical, and we have a group of 6 medical doctor ophthalmologists and 5 ODs that we really partner together to do high volume surgery. We have a niche in refractive cataract surgery. So I would say at least 50% of our patients are hoping to have spectacle-free vision or less spectacle dependence. So I've been doing cataract surgery for about 20 years, and it's my favorite day of the week. So, but I would say on average, I have about a 50% upgrade rate. And I have a lot of patients who are hoping to have, great distance, intermediate, and near vision. I specifically love recommending ClearView3 to our myopic patients who are kind of in that moderate range. So I would say from about a -2 to a -4. Those patients, we kind of joke around as ophthalmologists that we can never make those patients happy with their reading when using a multifocal lens until the ClearView3 came along. And we're finding that those patients are extremely happy with their near vision. They achieve the vision that they're used to seeing when they pull their glasses off. And then of course, we're excited to be able to then give them distance vision for once in their life without spectacles or contact lenses. I love to recommend this lens for patients who are moderate myopes, who are between let's say a -2 to a -4, or for folks who cherish their near vision in the hobbies and activities that they do, such as crafting, jewelry, just having to have their focal point closer to their face, and would love to be able to do that unassisted, so without reading glasses. Many of my patients will have what I call a night spike. So there's a line of kind of like an astigmatism induced ray coming from those point sources of light. And I will tell our patients that you may get this side effect. And the good news is, at least in my hands for the past year, not one of my patients has been left with so much intensity of that night spike that they can't, for instance, drive at night or are bothered. They neuroadapt very, very well. Those spikes will reduce and shorten over time to the point where the vast majority are not even noticing that anymore. But I like to be very upfront and honest with my patients and explain that yes, you can avoid a halo, but you will have potentially this other side effect. Of course, I have some patients who have no side effect at night, and no dysphotopsia whatsoever that they can talk about. And they've, when I question them in post-op, they'll say, I'm not having any issues. I'm doing great. I don't see any of that spike and I never have. But I'd rather pre-warn my patients about this expectation and then not mention it at all. I really do enjoy that this lens comes in quarter diopters. I feel like I wish all of the other lenses available to us came in quarter diopters, because with that quarter diopter step, I'm able to usually find what I feel is the closest and most appropriate power I could possibly give to our patients. I think the ClearView3 is disruptive in a good way because, it's for the last decade plus that I've been implanting multifocal lenses, they've all been the same concentric ring design. And so any technology that is going to change the typical design is going to be another step forward towards better and better outcomes, patient happiness. So I love seeing it. And that's why I'm willing to try new technologies and was very eager to try ClearView3.